Yeah, so I welcomed Dr. L. Shreenivasa Murthy. He is a MD physician and has all the possible degrees in the field of diabetology. And Dr. Srinivasa is involved in this research work and teaching over 19 years. He has his own center in the Bangalore, very well known practicing diabetologist in Bangalore city. He has been a part of the US FDA audit and Diane audit also. And
Canadian
he
audit.
has been, yeah, Canadian. Okay, the CNS
Yeah.
Canadian audit also. And he has been a principal investigation over 75 clinical trials and part of the landmarks trial like Hope 3, Clarify, Begin, Dual, Alexa, and etc. And he has been fellow of Royal College of Physicians, Edinburgh, and fellow of Indian College of Physicians. So he has lot of credits to his success, and I'm inviting him to start his lecture. Welcome, Dr. L. Srinivas.
Thank you, sir. Thanks for the kind introduction. I think post-lunch session, we are beginning our first lecture. My screen is visible, sir?
Yes, sir.
It's visible? Changing?
Not it, sir.
Not it. Okay. One sec. Oh, I think Ankit in between shared the screen.
Yeah. Yes.
Visible now?
Yeah, visible.
Yeah. Slide share, please.
Great. I think good afternoon, everybody. Post-lunch session. I sincerely thank organizers, in particular, Dr. Bansi Sabu is a big inspiration for most of us now in organizing such successful conferences. So advantages of electronic data and the challenges in our country and way forward is going to be my talk. And next 20 minutes, I'll try to do this. We know it, the online consultations have started way back in 1876 when Alexander Graham Bell invented his telephone. And if you see this newspaper cutting of radio news in 1924 in USA, it was called as a science fiction, The Radio Doctor. So today we are physically seeing literally all of us in live through video calls, video chats, etc. So the healthcare industry is the world's largest and fastest growing industry, contributing to about 10% of the overall GDP. So far, like other industries, being one of the largest, where do we stand in technology revolution? That is the big question for all of us. And patients now have become consumers thanks to all the laws of the land, where they are seeking now personalized approaches, transparency, and more control of their overall healthcare experience. I'm sure all of you will agree the wave of digital transformation is taking place in the healthcare industry. So just to look at the now and the future, early 2000 or early part of the decade, this used to be a slow, manual, disconnected, episodic kind of thing for the teleconsultations or the technology in the healthcare. And then in 2010 to 16, there was a progress with a better coordination, health activity, significant population was involved in this. And now until 2020, from last 5 years, we have a better member experience. Personalized interactions are always possible now, multi-channel, and it's integrated. Going forward, we are definitely going to have artificial intelligence in our data-driven approaches to various patient approaches, and it's going to be a prevention and predictive smartphones, which is going to be real time. I'm going to show a couple of slides, and I'm sure all of you will agree, technology is transforming various industries for betterment of the patients. And in our industry, that is pharma, artificial intelligence, the drones or the robots are playing a major role with the 3D printing. I'm sure all of you will agree with this. So the technological advancements to improve outcomes, what we have is a more personalized mobile phone apps, which makes us to stay in touch with our patients even after the healthcare facilities are closed. And this internet of thing, which is a changing everything from patient records to monitoring to inventory control to prevention or preventive care. And it's going to be a real-time one, which is very, very important. 3D printing is going to be a big boom to our industry, especially when it comes to the prosthetics. And the other thing is EHR, electronic health record, is a systemized collection of patient and population electronically stored health information in a digital format. And this is going to be a big boom in our management of patients. And the mobile health is another one. Without any cards or wires, the patients are connected. Telemedicine is the end product of most of these, where we incorporate most of these technologies in the telemedicine in the patient management. Just to show you, look at these various sensors available now. Eyeglasses which can detect your glucose. There are contact lenses which can detect your glucose. There is the microfluidic sensor which can again detect glucose, and integrated sensor array. You can see the watches, the variable diagnostics which can include various aspects. Now this just to show that literally your heart rate, your ECGs are seen with your Apple watches, as you are aware right now. There are ground reaction force sensors. There are wearable jackets, just like you wear your jacket, you wear for a Holter monitoring. It's already approved. Next year it is going to be launched. There are already CGMs, ABPMs where remotely you can get data on your mobile phone, and there are glucometers also. So just to introduce the information and communication technology, what we commonly call as IT, and it is incorporated in all the sectors, I'm sure. It has transformed the way healthcare data is managed. So the widespread usage of these electronic gadgets has put us the availability with the availability of high-speed internet have made possible the transition from paper-based patient records to electronic records. So this IT has created a paradigm shift in the way we handle our patient clinical data, store them, and use and disseminate them. And evidently, there has been a gradual shift from paper-based to electronic records, and these are called in various names. EMR or EHR is one of the commonest, electronic medical records or electronic health records. Now, India is embarking on a journey towards providing universal health coverage through various government schemes. We know that through a multi-pronged approaches of reducing the catastrophic out-of-pocket expenditure for our patients. And it is envisaged that the health information technologies that we call HIT or digital health would create enabling environments for addressing some of the systems level challenges in healthcare delivery. Sorry. An electronic medical record, what is the definition? It's a unique longitudinal electronic record of a person's health over life course that comprise of patient's demographics, progress notes, clinical problems, medications, past medical history, lab attachments, etc. And it can be accessed instantly, securely by authorized users. That's the most important. Instantly and securely it can be authorized. So this is what it comprises of, the EHR system. Now, the benefits of EMR are manifold. Some of them, they ensure the records are easily accessible anytime, anywhere. It can be stored easily in less space. Being in electronic format reduces the number of records lost, improves the quality of patients' records, are cost effective, helps to track patients' clinical progress, gives a summary of reports, and even artificial intelligence can be incorporated into that. We can give graphical representation of the same, like a HbA1c or a fasting sugar or a height, weight, weight of the patient over a period of time. It helps to improve the accuracy and speed of diagnosis. It can be transferred easily within and across the healthcare facilities, like in a given hospital, across specialties can view the same patient with a single ID. It's easy to update and can be available to be used by multiple users, allows keeping backup of patient's record at a very low cost. EHR facilities improve healthcare decisions and provide evidence-based care, and it can be used for research purposes, very, very important. So eco-friendliness, saves paper, reduces time, and the strong database for research, and there is an e-education or training which can be done online again. Now, this is the advantage. Now, what are the challenges faced by Indian healthcare establishment in the implementation of this electronic health records? Of course, the barriers preventing technology adaptation by HCPs are manifold. As you can see here, these are the questions asked by HCPs. The tens and thousands of apps are available. How do I choose? Do my patients have a role to play in this technology? What would my patients want or need digital health? And these are all the various questions asked by healthcare very, very commonly. Wearables can produce a lot of data. How can I manage this? How do I use this technology? Where's the evidence for using digital health solutions? These are all the various questions asked by the HCPs. Now, the key challenges include the success of electronic health records relies on the acceptance by the clinicians. And because of the various patient loads in most of our OPDs, it's a key barrier to use this, because if you're not tech savvy, you're not going to be liking this. Lack of common understanding between the clinicians and the software development teams. So there has to be coordination when you design an application. Hospitals tend to focus primarily on the billing and revenue cycle. I'm sure all of you agree with this. Most of the corporates do this. And thus, the technology solutions are deployed only to address the billing and revenue cycles rather than incentive to the clinicians. Now, loss of face-to-face interactions due to technology disrupting the clinician's patient communication is a major drawback of these EHRs. Not engaging with the end user, that's the patient involvement is not there. And most EHRs do not consider the patient behaviors into the design process, unlike in the past. Now, the many patients are technology savvy. maintain their treatment related records in electronic formats on their mobile phones, etc. So you have to incorporate them also. There are no mechanisms in most EHRs which allows the patients to contribute their valuable clinical and treatment related informations into the healthcare delivery systems. Healthcare in India is provided in a multilingual context. However, most EHRs lack these multilingual capabilities, language barrier. And fragmented multi-specialty approach is another hindrance for the EHRs. Unwarranted repetition of investigations, thereby increasing the financial burden on the patient healthcare systems, especially when it is involved in many verticals like a tuberculosis control program, vector-borne diseases, NPCDCs. All these will collect various information and similar data is collected repeatedly, and this may be a cost burden onto the patient. Now, the common electronic data repository will sort out all this. Better interoperability of these systems should be there, and lack of any incentives for the clinicians for using EHR. Like there should be some encouragement incentives in a corporate setup or in an outpatient setting that makes them to accept very easily. Specific challenges: relative lack of computer literacy, poor change management practices, lack of uniformity in EHRs, lack of synergy between the healthcare providers, resulting in non-interoperability or data hugging, what we call, lack of operating system in the EHR, lack of awareness, the no mandatory requirement. That is, all these makes a person that is a physician to not to use these systems. So time needed to install, train your staff, hardware, network issues, electricity, learning curve of the office staff. That's very, very important because your office staff has to be equally learned when it comes to handling the EHRs. The computer may act as a barrier between the patient and clinicians, security and safety issues. These are all the things which we need to look at when you choose a particular application for management of the records. And initial buying cost, prescription and local challenges, QR generated codes are available, after scale services in the process, can it be used in mobile or laptop? All these questions are rightly pointed out. There are a lot of physicians like Dr. S.V. Kulkarni, who does a lot of work in this electronic and educating people, and he conducts various workshops in a lot of conferences. Now, overcoming challenges. Now, what are the solutions? Obviously, we need to sensitize healthcare workers on the importance of EHR, introduce data science and health informatics as a part of curriculum in medical and allied health subjects. This is the most difficult task because as soon as you come out, it's like reading ECG. During MBBS, nobody teaches us to read a ECG. When you join MD, you're expected to know the ECG. It's something like that. So there should be a synergy between healthcare professionals and software developers. The national repository is something which is a welcome move, like in NHS in UK. Utilize open source operating systems and tools for developing EHR, and use standard clinical workflow guidelines, and including clinical workflow guidelines for developing EHR solutions should be formed so that everybody are in the same page when it comes to the use of EHR. And use to improve usability, natural data input such as handwriting, voice could be considered in the EHR, because most of us are the typing may not be very fast. So we can incorporate this handwriting or voice enabled things so that it automatically transfers into the digital. Sensitization of the workforce through training of doctors and nurses. Patients should also demand implementation of EHR. That's from the patient side. This might be a step towards putting the person at the center of the healthcare delivery system. Now, we'll skip this for want of time. Now, relevance of emerging technologies example is being a mobile phone and internet-based messaging platforms. Unstructured data sets could be leveraged to build health data repositories across the country. Citizen Digital Locker, which is something launched by the government, could be another potential resource for citizen health, personal healthcare record, or portable EHR. So, way forward, we need to improve the usability, user experience of EHR, such as incorporating voice-based inputs, handwriting inputs, natural language processing and machine processing, learning techniques for clinical coding, decoding, contextuality of augmented clinical decision support systems. Data is an emerging currency equivalent. Please remember that. The more the number of data you have, the more the value going to be in future. And India, our country, has the potential of becoming the global capital of this ecosystem because we are very good with the IT. To conclude, the development and implementation of EHR in India are still in the fragmented stage. In this journey, a national standardized EHR may be the first step. Now, leveraging the technology to improve outcomes, continuous monitoring, retail clinics, connected home, auto patient accessibility, virtual care circles, omni-channel experiences, intelligent treatments. For want of time, I'm not discussing individual components of this leveraging technology. How do you do it? Definitely artificial intelligence, intelligent machines like drones are something going to be in the future. So for better outcome, there are 4 pillars for these digital initiatives. This is smart care, care anywhere, empowered care, and intelligent health enterprises, something very, very important. Now, this is one move from the Government of India, Telemedicine Practice Guidelines, launched 25th March 2020. It is part of normal practice. You can use it. It provides practical advice to both the doctors and the guidelines and regulations to make it safe and patient provider. And we know ISRO had launched in 1980s this launch of telemedicine way back in 1980s. Lakshadweep and J&K were covered. Those Andaman Nicobar Islands were covered. The features of telemedicine is important. I'll just touch upon few slides. Doctor can choose the medium of telecommunication, whichever means you want. He has to maintain the same standard. Patient is responsible for the accuracy of the symptom. Caregiver can give the information on behalf of another patient, like a father or mother of a child. So you can use chat, text-based, video consultation, audio consultation, literally everything. This flow chart shows the flow. How do you do? After you take a consent, you decide whether telecommunication or emergency advice is required. If emergency, please stop telecommunication, refer them to a physical consultation. If not, you can go take the proper history, do the management strategies, which can be health education, counseling, specific treatment, and then you can send an e-prescription online itself. And we know during COVID, the physicians can interact with the patients, gather history, analyze their self-monitored SMBG and self-monitored BPs. This is for chronic diseases, and telemedicine has allowed us to consult the physicians away from hospitals, which could lower the chances of COVID infections. I'm sure all of you have experienced this. Just to show you some evidences, RCTs, randomized controlled trials of telemedicine, which has proved beneficial to bring down the A1C. Even a Cochrane review of 21 RCTs of patients with diabetes has shown that about up to 0.31% compared to patients who didn't use the telemedicine has shown the benefits of telemedicine. And telemedicine is here to stay. Look at this Economic Times and Business Standard snippets, which has clearly showed that telemedicine could save India $4 to $5 billion every year. And this is showing again the growth story. It's firmly here to stay. There is a right time to jump on the bandwagon. Telemedicine expansion is fueled by the massive growth of mobile data consumption. It's going to be about 40% annually for the next 5 years. And that is what is going to be expected. About 1 billion Indians are supposed to have smartphones by 2025. Out of 1.3 billion population, we're going to have this. So by 5G advent, we're definitely going to move forward. And in future, with faster connectivity, more data transfer, it means that the 3D telepresence market, you can literally be present with a 3D picture in patient's house and to take care of patients. This is what we are going to do now. We are doing a virtual 2D video call, but it can be a 3D video call where your image just goes on and you can see the patient virtually, similarly on your side. So the way forward, it is important to focus on following broad issues in this initiative have to be succeeded on scale, proper training of doctors, educating them, healthcare professionals. A much higher level of public-private partnership is needed. Appropriate IT infrastructure should be in place. Working towards standardized EHR is a must. A national health IT policy needs to be formulated. Efficient management structure to deploy EHR should be in place, and efforts should be made to sensitize healthcare workers related to the importance of the electronic health records, and synergy between software development team and the healthcare delivery system should be there. And organizations like RSSDI, API might has taken that lead. Create, train the trainers, mentoring program can be e-based. Go down to district, sub-district places to encourage creating the e-data. Being in accordance with the laws of land, of course, we need to follow the telemedicine guidelines. To conclude, international telemedicine initiatives are bringing the world closer, and distance is no longer a barrier to attain a quality healthcare. Lack of awareness, acceptance of new technology, both by the public and the professionals, are challenging in wider use of this technology. Governments now are starting to take keen interest in developing technology-based practices because they know they can save a lot of costs, and technology can be utilized effectively in management of chronic diseases during pandemics like COVID-19 and even afterwards. So I just foresee in our country, there can be a booth like this, which used to be a telephone booth earlier days, the kind booth, a biosensor equipped health quest where there is a total privacy. You just get inside to this, you wear sensible wearable sensors. I showed you a watch or a stethoscope, virtual stethoscope, all that. And then you can get a consultation by the doctor who's sitting in a remote place, and you can UV disinfect this place after every use. And this is going to be available in airports or in busy places like marketplaces. This is what I see as our future India because of the digital or the IT revolutions what we are having in our country. So let's embrace the digital for brighter future. Thank you very much. And these are my references. Any questions, I'll be very glad to answer. Thank you very much, sir.